and good evening to everyone out there in TV, radio, and internet land. Welcome to another very impactful episode of HealthWise. I am your host, Dr. Monique Lescott, in collaboration with the St. Kitts Nevis Medical Dental Association and ZAZ Broadcasting. Welcome again. So I have with me a jam-packed panel with some very interesting guests. On my immediate left, I have Mr. Travis Rogers. I will have him introduce himself and his position, what he does, and why he's here shortly. And to my immediate right, I have Mrs. Blake, Mrs. Michele. Yep. How you pronounce? De la Coudray? Yes. I'll just stick to Mrs. Blake. And to my far right is Miss Karimu, Byron-Caines. Welcome, you guys. Welcome to the panel. It's a pleasure having you guys here as part and representatives of the St. Kitts National Drug Council.
St. Kitts Nevis.
Nevis, sorry.
Council.
St. Kitts Nevis National Drug Council, or Nevis, I'm so sorry. Okay, so we're going to have you guys introduce yourself. I'll start with you, Mr. Rogers.
Okay, thank you, Monique, our host. I hope you don't mind I call him Monique.
Yes, you're legal. You're legal.
Okay, thank you. I am Assistant Commissioner of Police, Travis Rogers, but I hold two caps. I am actually the Chairman of the National Drug Council.
Okay, awesome. Nice to have you. And Ms. Blake.
Okay. Good evening. I am Michele de la Coudray-Blake, a psychological counselor by profession, and I am on the National Drug Council, the St. Kitts Nevis National Drug Council. I represent the Ministry of Social Development, Community Development, and Gender Affairs.
Awesome.
Yes.
Good to have you here. Welcome.
Okay.
And Mrs. Byron-Caines.
Pleasant good evening to everyone viewing or listening tonight. I am, as Dr. Lescott said, Karimu Byron-Caines. I am the Executive Secretary on the National Council on Drug Abuse Prevention, and I also act as the Director for its Secretariat. And I'm happy to be here tonight to shed more light on the work that we do and who we are with your viewing and listening audience.
Awesome, and I'm excited to also share my platform with you guys because I'm also a volunteer member of the St. Kitts Nevis National Drug Council myself, so I'm also involved in a lot of the community work aspect of it. So I'm eager to help you guys get the program and your goals off of the ground. And this is one of the ways I think would be effective in doing so, is to let the public know what we are about. So I'm going to start the conversation. Could you, I guess you can decide who will go first. Who will tell us what is the National Drug Council all about? Who's going to take that one?
I'll take that question to get us started. So the St. Kitts Nevis National Council on Drug Abuse Prevention is the government's central or the main drug authority for St. Kitts and Nevis. Mm-hmm. We were established in 2001 under the Drug Act.
Wow.
And we are located within the Ministry of National Security. So the main goal of the National Council on Drug Abuse Prevention, we say National Drug Council for short because it's a mouthful.
Yes.
So the main goal of the National Drug Council, it's basically to coordinate all drug-related activities related to drug prevention.
And I guess abuse.
Right, the prevention for misuse and abuse of substances, harm reduction, as well as just ensuring a healthy and safe community for all. So in a nutshell, because the Drug Act outlines a lot of functions, I think the chairman reminded me it's about 18 today, but in a nutshell,
18 what?
18 functions of the National
yes.
Drug Council. But in a nutshell, all of that to say, it could stem from public awareness and education to the development or support of drug policies, training various frontline officers in the health, mental health field, but also in the security and control sectors as well. It entails facilitating programs, sessions, and different types of advocacy.
I would think that we have some sort of direct communication with persons in in the House because we're speaking about policy making, and so I guess we also have direct communications with those persons who have the power to ratify these things.
Yes.
Right, correct. And as a matter of fact, last July, we went through a multi-sectorial engagement over a period of time, and we had our national drug policy, which was approved by cabinet.
That's what I was
last
getting at.
July,
Yes.
July 2024. So we're now in the implementation phase of that policy.
Oh, that's awesome. I should give us a clap. Okay, that's really awesome to know. And that's I realize that you said everything from off of the top of your head, so I can tell that you're very passionate about what you do, because you are able to memorize almost anything when it comes, honestly, almost anything when it comes to this subject matter. Every time I've approached you about asking any question, you've always known the answer without referring to anything.
At the times where I have to refer, I won't take it. But I am very passionate about the field. There's a strong why to me being here, so it pushes me.
Awesome. So we need people like you. Anyone else want to elaborate, or did she cover most of what we needed to say about what the Drug Council, the National Drug Council, is all about?
Well, yes, in a nutshell, she quite articulated the functions, and it's quite a bit. So I think if she has to go through all, we'll be here until midnight tonight.
I could imagine, because 18, you said it was 18
Yes.
functions.
Yes.
And I guess, and counting, because I guess we'll probably add more as we see the need arises. Okay, so we'll move on. So who comprises of the National Drug Council? Who's going to take that one?
Okay, I'll take that one. And I generally would not do like our executive secretary and go from the head. So I have made sure I walk with my axe. I can be speaking the facts.
Wow.
As it is, all right? So the Drug Council under the Act, section 31, subsection 2, outline that the council is made up of a chairperson, which is ultimately myself, a vice chair. We have a representative from the Attorney General's office, permanent secretaries or their representative in the office of the Prime Minister and the Premier's office, respectfully. We're talking about Sengis and Nevis, of course. The permanent secretary or his or her representative in the ministry responsible for national security. Permanent secretaries or their representative in the ministry responsible for social development, community and gender affairs. And we have Mrs. Coudray-Blake right here with us. Permanent secretary or his or her representative ministry of responsible for education. The financial secretary or the representative for finance and planning. Permanent secretary or his or her representative in the Ministry of Health. And we go to Ministry of Youth, Sport and Culture in the Federal Administration and the Nevis Island Administration, respectively. The Comptroller of Customs or his representative. The Commander of Coast Guard or his or her representative. Commissioner of Police or his or her representative. A representative from the St. Christopher and Nevis Medical Association, representative from the St. Christopher and Nevis Bar Association, two representatives from the St. Christopher and Nevis Religious Organization, one from each island, St. Kitts and Nevis, and 3 persons appointed by the minister. In this case, the minister is Minister of National Security, and fortunate for us, it's the Prime Minister, Dr. Terence Ju.
Okay.
So that is what the composition is like, a wide cross-section
of persons,
of different agency and sector that builds out the National Drug Council.
Okay, that's quite a wide cross-section of persons.
Definitely important.
And I guess we can say we pulled persons from all of the major pillars of society. There is law, there is medicine. What was the last one you called? That was
this was
national security.
Yes, well, the last one I spoke of is from basically the Christian Association for Religious Organization, and then we had persons appointed by the minister.
Can we? I guess we can take a short commercial break, and when we come back, we'll continue our discussion.
The dangers of sweet beverages.
You're supposed to tell me when.
It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
Good evening and welcome to our first time viewers and listeners to our episode today of HealthWise, and for those of you who are returning, welcome back. I am your host, Dr. Monique Lescott. I have with me on my panel with me tonight Mr. Travis Rogers on my left. My immediate right, I have Mrs. Blake, and on my far right, I have Mrs. Karimu Byron-Caines, and tonight we are discussing drug abuse prevention challenges and the intervention initiatives of the St. Kitts Nevis National Drug Council. And so we're going to continue our discussion. I'm going to take it to Mrs. Blake.
Okay.
So what are the key focus areas and target groups for the council's work? Like this clarifies who council serves, the vulnerable groups.
Yes, okay. So let me try and see if I could contextualize it and sort of bring it down, because we have just a few minutes here, and you know, as ACP Rogers indicated, the work of the council is so extensive that it's difficult to sort of bring it down. So let me talk about some areas, some primary areas: demand reduction, supply reduction, and institutional strengthening.
Wow.
Out of that, I am going to pick demand reduction, just because it is just my area of strength and knowledge and awareness, and it's something that I could speak to. So again, just extensive work. But when we're talking about demand reduction, it simply says what it sounds like it says. Creating an environment, a supportive environment through education, through institutional strengthening, through policies, to make sure that there's an environment that reduces the likelihood of people having access to substances and wanting to use substances. So in order to demand that, to reduce that demand, obviously there are different things that have to happen.
So you basically remove the stressors that would make people want to use drugs as a coping mechanism?
Not just that, all of the circumstances, because people don't just use drugs as coping mechanisms. Adolescents use drugs, you know, they dabble in just because it's a part of their developmental stage, you know, so there's risk-taking behavior and so forth. So there are these kinds of things. But in order to kind of, you know, just go on with what I'm saying, when we're looking at demand reduction, there are a couple of things we have to do. There must be education. So there must be education and information sharing. That has to be intentional. There must be prevention programs developed to be able to address the issue of substance use before it becomes problematic.
Do we have any of those programs that we can touch on after you finish?
Well, as we go along, those will come on. But there are, again, these are the areas of focus. We have to be able to focus on treatment and rehabilitation. We have to have options for people to be able to get the assistance they need. We have to be able to engage communities, because people live in communities. They live in families and they live in communities. And at the end of the day, people have to return to and actually be supported by their
community. It's true.
And so that is a part of the overall scope when it comes to demand reduction. And we really have to look at harm reduction practices. And harm reduction, when we're looking at our areas of focus, harm reduction really speaks to how do we safely make sure that people who use substances have resources available to them to be safe in their substance use.
One question I have, we're going to put a thumbnail on that one, because some substances require not just intervention in terms of counseling. Certain narcotic would actually to rehabilitate the person, to detox the system. Do we have a rehabilitation, I wouldn't say center, I know we don't have a center, but in terms of persons that might be hooked on hardcore narcotics, for instance, if you're hooked on, I think it's heroin, you would need there is a medical.
Yes, a narco something. Yes,
I forgot what was the name of it. I think it's. Let me not quote it, but it's a particular medication that you would use, and once that person is on the rehabilitation program, once they're on that particular medication, they cannot mix street drugs with it. It's a very lethal combination to use the detox drugs with street drugs. Do we have anything like that here yet?
We know our journey in our in our treatment options. We haven't gotten there yet, but we recognize, and of course, what you talked about comes from information, and the more information we have, the more we recognize what trends are playing out in St. Kitts and Nevis, and so when we know what trends are playing out, then we know what we need to do to be able to address the treatment options for those. But really, there are all kinds of treatment options, and even you talked about medical assistance, because that's what you described. But treatment options are also therapeutic psychotherapy. There are living spaces and spaces that support people. So there are all kinds of treatment options that we learn about, and we continue to get information about, and we want to encourage that use. But just to finish up what I was saying, and you're talking about our focus areas and our most vulnerable populations. The thing is, with most vulnerable populations, that is not a static kind of situation. The populations that are vulnerable, those populations, that information is dynamic. That situation is dynamic, and it changes based on trends, based on availability of substances, based on all kinds of things. So with respect to us and our response in terms of most vulnerable, we recognize that we always have to be following the data. What is happening in the country, in the world, that speaks to who is vulnerable and how they're vulnerable. And so as that information becomes available, then of course we target our interventions and our programs and our outreach and our information and messages to make sure that those vulnerable populations are heard. But that being said, one of the most vulnerable populations that we always focus on is the youth. Youth and adolescents. I mean, because they have so many issues that they have to deal with that contribute to that vulnerability. Their developmental stage, where there's natural risk taking, that contributes to vulnerability. The chaotic life situations that many of them may live in, that contributes to vulnerability. The fact that just emotionally and psychologically adolescents and young people are just searching, and they are vulnerable. And so that's a vulnerable group that in all of what I've said, that the National Council on Drug Abuse Prevention really tries to hone in on that adolescent group.
I agree. Okay. So, because the target groups and the target populations are dynamic, I suppose then, how do we keep up? Because then the target population this year might be different 6 months from now or even next year. So I guess, do we also have any ties with the statistical departments?
Okay, so apart from the statistics department, one of the areas that I didn't mention in the long overview of the National Drug Council is that we also partner with regional and international partners in the field. And so through an organization, the Organization of American States, in particular the Inter-American Drug Abuse Control Commission, that we say SICAD for short, they really have supported us at the National Drug Council in carrying out surveys, right? There's one in particular that addresses the youths. It's the Secondary School Drug Prevalence Survey. And although it's somewhat dated, it is on our list in our policy as one of our implementation activities within the next 4-year period. But from that secondary school drug prevalence survey that was conducted in 2013, what we realized is that there was roughly about 50% of the secondary students who reported that they would have tried alcohol. And there were 1 in 5 who reported that we would have used marijuana. And this is all before the age of 12.
Wow.
First age reported at about 9 years old.
Using marijuana?
Any form of substance. It's like kind of exploring things along that line. It's not a regular use, but they would report it first using substance. It could be alcohol, it could be marijuana as early as 9 years of age. And for me, that is very concerning.
That's very, very, very concerning. And we spoke about this at length in some of our drug council meetings, and there's a need for the shop owners to be more cognizant and to not sell alcohol to minors, and to, even when we have fetes and big events, we cannot control sometimes, I guess, who attends these functions, but I think the bartenders could be a bit more cognizant about who they sell alcohol to, you know. We're going to elaborate some more when we come back. We're going to take a few short moments to pay some bills, and we'll be back shortly.
Thank you. Yeah, man. Another day in the books. Well, hello there. She pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
And welcome back again. I am your host, Dr. Monique Lescott. For those of you who are just joining us, welcome. And for those of you who have been here before, welcome back. I have with me on the panel Mr. Travis Rogers on my left, Mrs. Blake on my immediate right, and on my far right I have Mrs. Byron-Caines, Karimu. So we're going to continue our discussion on the topic drug abuse prevention challenges and intervention initiatives. So we're going to continue on the statistical aspect of the work that we do.
Okay, so sure. So along with the international partners sharing that type of information on statistics, you would have heard about the secondary school drug prevalence survey. About 50% of our students are already consuming some form of substance. Another compelling survey we did, and a particular finding that always stands out to me, was a prison drug survey. I don't recall we doing it some time back. And that survey revealed in one of its findings that 52% of prisoners in the combined sample, because they did it, well, at the time it was Her Majesty's Prisons and Nevis Prison Farm, but they would have reported that when committing the crime that caused them to be incarcerated, there was 52% reported being under the influence
of something,
of some form of substance. More than 50% of them who reported being under the influence of a substance was under the influence of alcohol. And then what is more compelling for me is about over 60% of them said had they not been under the influence
they were
of
not
the
going to do
substance,
it.
they do not believe they would have been able to commit that crime. So I mean, these statistics are very alarming and concerning, and it really pushes us to recognize that prevention and intervention is not an option, but it is an essential tool. It's essential for us to ensure that we are safeguarding our population, especially our young people, as early as possible.
But I'm very confused as to why any adult, I could understand children would experiment, they would get into things that they're not supposed to get into, but I don't understand why would an adult initiate such a young child into such a destructive life path. I know sometimes I've seen it, like if it's a little child, it might just dab him out with a little alcohol, but I really don't like that. I really don't like adults introducing children to stuff that can be a gateway later on. But I guess that story is for another day.
but I would like to add on that though, because from one of the surveys that we did, what we realized, we asked the children how they were introduced to substances. I don't know, ad hoc we would think it's a parent or it's a father, but in the results that we saw, the majority of influence was peer-to-peer.
That's what I'm saying. Like, so
And then following the parents, mother or father, was only about 1.something% were introduced by a parent. So I won't put the parents on the spot tonight. I just wanted to clarify that. But the majority of persons who started experimenting at a young age, it was peer-to-peer.
Interesting. So now we have to figure out where they're getting the alcohol and the other stuff to be experimenting with amongst themselves. Okay, I guess that's something we need to, we will definitely need to look into. So how does substance abuse currently pose a threat to public health in our community? Who wants to take that one?
I'll go with that. And I think it sort of is just following on from what Mrs. Byron-Caines just said when she gave the story of the information that they received from the data that they received, the information that they received from persons in prison when they're talking about the committing of a crime, and they talked about it, you know, just being under the influence, and that in and of itself is a public health issue, because as a result of them committing crime, they are in prison. It means then that the judicial system and the legal system is burdened. So you have all of those things happening. So when we're talking about posing a threat to public health, we're talking about how substance use overwhelms and undermines those resources that are public and that the government has to be able to manage.
Give us an example, like how, that's a good point, but for the sake of the educational purpose that we're doing here, you can give us an example of how drug abuse can really put a dent in our public health system.
Okay, all right. If you're talking about, let's just take accidents.
Oh yes, with the drunk driving.
And if you collect the information on all of the accidents and so forth that happen, the people that end up in A&E, the stress that puts on the A&E when you have to deal with the victims of accidents and all of the other things, that's a public health.
That's a public health burden. How many road fatalities have we had for the year? Do you know offhand?
Yes, I don't have the exact figure, but it's one too many. And like you said, most of them are under the influence
of something.
Yes.
So to continue on, when you're looking at taking your money, so if you're looking at, for example, the monies that have to go into providing treatment options, treatment centers and institutions and options for
the rehabilitation for the accident victims.
That's resources that we have to use.
That's true.
When you talk about the fact that substance use and mental health, those disorders go hand in hand. And so if you have increase in substance use disorders, you are going to have
increase in mental health disorders as well.
And again, you're talking about just putting strains on the resources that are there. If you're talking about even just family and social impacts, if you're talking about the potential impact of substance use on a family, domestic violence, violence against children, neglect, all those kinds of things, where families have to be disrupted to be able to take care of those people in the family who have been impacted by substance use. There is a strain on society, and there's a strain on the resources that make a society healthy and keep a society healthy.
I agree.
So public health isn't just about spending money, and when we think of public health, that's the first thing that comes to mind, the fact that we have to spend more money to take care of.
Yes.
But we are also saying that all of the things that are associated with substance use strain our systems, strain our natural resources that take care of us. They just put strains on us.
That's
and
true.
so it's a public health concern just across the board. You're talking about crime, and so people like ACP Rogers, instead of using his men to do,
other things,
he has to stretch them to then address all of these other things. And so then the public health issue as it relates to crime and the commission of crime and all those other things then become a part of the rollout, or how substance use plays out in our communities.
I don't think sometimes we recognize how much of a burden because that was a no-brainer, but somehow it didn't come to me until you elaborated just now, especially when it comes to the strain on the hospital and the caregivers. So I'm going to take a few short commercial breaks so we can pay our bills, and we'll be back shortly.
Every smile,
Good job,
every hug,
Roxanne.
every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
Good evening and welcome back. My name is Dr. Monique Lescott. I am your host for tonight's episodes of HealthWise. I have with me the introduction to our medical personality spotlight tonight. It gives me great pleasure to introduce Dr. Trevoncia Stanley, who is a fellow colleague of mine at the Joseph and Franz General Hospital. I will give to you Dr. Trevoncia Stanley.
Our medical personality is Dr. Trevoncia Stanley. Dr. Trevoncia Stanley is a proud daughter of the St. Peter's community. Her medical journey began in 2017 at the Escuela Latinoamericana de Medicina, or ELAM, in Cuba, where she studied for 3 years before completing her degree at the Universidad de Ciencias Médicas in Las Tunas from 2020 to 2024. Dr. Stanley now serves as a dedicated physician at the Joseph N. France General Hospital, where she has worked in the maternity, surgical, and pediatric wards. She is currently working in the Accident and Emergency Department. Known for her warm personality, compassionate care, and strong work ethic, Dr. Stanley enjoys spending her spare time at the gym, where she finds motivation, strength, and balance. She also believes in adopting a healthy lifestyle and eating habits as a way to help prevent chronic illnesses such as diabetes. With discipline and heart, she continues to make a meaningful impact in both her workplace and her community. Our medical personality is Dr. Trevoncia Stanley.
Thank you very much, Dr. Trevoncia Stanley. We appreciate you at Joseph N. France General Hospital. Continue with the good work. So we're going to continue with our discussion, our very lively discussion. Just now we were speaking about, was it Mrs. Blake, the public health strain on drug abuse. What I wanted to put out there for anyone that might be able to assist, or I don't know what they can put into place, but persons who are addicted to very strong narcotics, maybe crack and cocaine, the withdrawal symptoms to quit that drug is actually very excruciating. Like that person would need medical assistance. There are medicines that can assist you or anyone who is hooked on such hard drugs to come off of it. They cannot come off by themselves. So I don't know if we call them methadone clinics overseas, like drug detox clinics. I don't know how soon we're going to have those sort of things on board in St. Kitts, but it would be a step in the right direction. Yeah. So we're going to move on. Do you have anything else to add to the public health aspect of
No, I think we touched on it. I think we just wanted to let people recognize that the public health aspect of it is broad. It's a broad brush. It touches just about every aspect of those support systems that we have in place. And so it just really kind of speaks to the fact that the impact of substance use is very far-reaching. Yeah.
Agreed. So we're going to move on. So what does the current data show, particularly regarding underage drug use? Did we do that? We touched that one? So we're going to move on again. What programs are currently being implemented in communities to address substance abuse, like, you know, the ground action, the successes?
Sure, no problem. I can address that one. When we are rolling out various programs, we always want to ensure that it takes on best practices and that they are at least evidence informed. And so I think COVID was a very difficult time for us as field officers because we were not allowed to go out to be with the school children or to have face-to-face engagement. So instead of going on the spur of the moment and facilitating sessions, we really used that opportunity when we were unable to go out into the field to build evidence-informed, well-rounded, structured programs at the National Council on Drug Abuse Prevention Secretariat, and I came prepared as well. And so we have a number of programs that we are currently we develop. Most of them were developed in-house with prevention science review by myself and clinical review by Mrs. Blake.
So you brought up a whole, you did a whole textbook?
Some of, yes, we have very structured
No, we have to show this. Listen, Mrs. Byron-Caines has to be one of the most talented people. Maybe we can have our own textbooks in school since we have persons who know how to author textbooks.
Oh, yes. So it's just like lesson plans and curriculum material for school. So we have at our preschool level a healthy and strong me. There are a few pictures displaying some of those engagements.
Awesome.
The various preschools throughout the Federation. I think it was last week we had our first private preschool come on board, and we also have the support of Dr. Lescott as a member of the Drug Council. There's a section there on medicines, taking medicine safely. And
just a second, maybe we can have the camera guy. Can you show us the footage of some of the preschools that we actually rolled out our program? Do you have access to that now? Here we go.
Right. And so the children are always very excited for the doctor visit. Just this morning, we meet regularly as a team, and one of the prevention officers shared that she was at an event, and a young girl, preschool age, ran up to her. And she was like, "Teacher, you don't remember me? You were at my school last year and you told me about keeping my body healthy and strong and that type
and the
of
hygiene,
stuff."
yeah.
So we're happy that we're making that type of impact. Along with the preschool program, we have Living Above the Influence 12 sessions. Primary
there they have me
school
there. Oh my.
Substance use education and prevention program. I am pleased to report this was rolled out in 2023, and based on post-mortem feedback, we upgraded the manual, we upgraded the lesson plan, and the Ministry of Education were so impressed with the material that it is now, as of September of this year, it was reported that they would be using this as part of the curriculum within their health and wellness program.
Nice.
So that is an excellent opportunity to ensure that our message of prevention and education is being spread.
Of course. See, one of the little boys is holding the book in his hand there.
Yes. We also have a refresher course, because where we have the primary school program, we thought it was necessary that when you get to high school, the earlier years, that you get a refresher on the substance education. So we have that 10-session program in our schools. We developed one along with the New Horizon Rehabilitation Center, but this one is more of an intervention program. So those are persons who are already experimenting and using substances. So this one is a 10-sessions program as well. It includes activities, videos, interactive sessions. We recently launched our Anchor project, which is a substance misuse high school intervention program as well.
How many books did you write?
It's just manuals, it's just curriculums to make sure everyone is on the same page, and if we're not available, other persons can step in and facilitate those as well. We also have a program in our prison for our inmates who are near release and would have had some sort of running with substance misuse or abuse, and we would have run a session there most recently at the Mavis Prison Farm, and we had about 10 inmates who successfully completed that
Oh, that's
program.
awesome.
And I think there is a picture as well in the stash of pictures that were sent related to that. And we also have a program. This one was not developed by us at the Secretariat, but it was in our international relations I spoke of. We had an international training, and there's this motivational enhancement therapy and cognitive behavioral therapy for adolescent cannabis users. So we have quite a number of programs.
Listen, I can't even hold all of them in my hands. Miss Byron-Caines is a very busy lady. Like, she has a whole Encyclopedia Britannica.
And it's not me alone. We are surrounded by, we have a great team at the Secretariat who is very diligent, and they too have their why as to what pushes them to continue doing this type of work. We have the members of the National Drug Council as well, who is always behind us and supporting us. I mean, I can call Mrs. Blake any minute. Mrs. Blake, I need your clinical review of this program or some intervention that we're doing. She's available. Rogers as well, he's a police, but he's also a drug treatment specialist certified through UE. Many persons don't know. So we can.
I did not know. Now I know.
Now you know. So there are a number of programs, and I'm only focusing on those at the National Drug Council, but I'm sure Ministry of Health has their own programs. But we're hoping in the future to have a more coordinated front, because what we find is people are working in silos and repeating. So in the future, we're looking at creating a more national format or structure towards the prevention and intervention program.
That is
so it's
awesome.
a lot that we're doing, and we welcome persons who are interested to reach out to us at the National Drug Council, and we are more than willing. And importantly as well, I almost forgot, our parenting program. Right, so at least once or twice a year we try to facilitate a parenting, because it's all good and well to go to the students, to the youths,
And
to
then
speak about
the
substance
parents.
misuse. But the parents are still struggling with parenting and educating. So we have that embedded in our programming as well at the National Drug Council Secretariat.
That is like really, really awesome. You have exceeded all of my expectations. I really was not expecting that rabbit hat of tricks, but it was well received, and I'm very happy, and I'm also very proud of you. I didn't realize you were doing so much work. I know that's a very tedious thing to do. I don't think people understand how tedious this sort of thing is. But before we go on any further, I'm going to have us take a look at what is happening at the Joseph and Franz General Hospital. We have the medical bulletin, and we'll be back shortly after those few short words.
Emergency medicine physician. Hi, good day. My name is Dr. Jason Eiffel. I'm an emergency medicine physician. So an emergency medicine physician is a specialist who deals with acute and urgent emergencies, unexpected emergencies, as well as undifferentiated patients who have illnesses that are sudden in onset and come to the hospital to seek urgent care. And we specialize in all sorts of emergencies: medical, surgical, gynecological, pediatric. So we see a bunch of everything. So I think having a more organized and structured emergency medicine system in the country would afford the citizens better care in the acute setting. I believe that patients will become more comfortable in the way they're treated in the emergency room, as their conditions are dealt with in an urgent manner. We want to reduce the waiting times for patients to be seen. We want to give persons the standard of care treatment, the treatment that they receive overseas. We want to bring that here as well. So I'm excited to get started. I'll be at the JNF General Hospital, and that's where I'll be.
The dangers of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
And welcome back. My name is Dr. Monique Lescott. I am your host for this week's HealthWise. I would like to thank you guys who have been here from the beginning. Welcome. If you are just joining us, welcome as well. I have with me Mr. Travis Rogers on my left. My immediate right, I have Mrs. Blake, and my far right, I have Mrs. Byron-Caines. So we're going to continue our discussion. I'm going to let Mr. Rogers take the floor. The topic that I would like you to cover right now is what are the goals, what are the aims of the council at this point in time?
Okay, thank you, Dr. Lescott. I'm now moved to an official name. And I just want to say how grateful I am for to be listening to our executive secretary and psychologist who have really spanned out a mouthful and show the works of the council. So in doing so, we have long-term impact and long-term goal. And I'll check my notes here, which is a vision centered on sustainability, impact and national transformation. First, we want to ensure that the programs and policies that we implement are not only effective, but that they are built to last. This means ongoing government and community support, because this would be the training and the strong foundation rooted in evidence and best practice, because we can't do it alone. So we're asking for government intervention and the NGOs, private sectors, to contribute to ensure that our programs are sustainable. Longevity, because it is important that they are sustained. We want to look at a home for our secretariat, and convincingly and happily that we are on our way to own our own home, because this getting this would only strengthen the structure and operations, improve coordination, enhance public service delivery, just by having your own home, because where you're comfortable, production and will be enhanced, and people are comfortable where they work, and it would help you produce. Let's look at the ultimate. We're working towards a future of the general public is far more informed, where prevention is embedded in our culture, and where people, especially our youth, and Michele spoke about our youth, who are we are targeting, have the access to support, education, tools that need to make healthy choices. And we can only achieve these through continued quality improvement, full partnership engagement, and a strong united front across all sectors. And that's the legacy we hope to build. All right, and what we would like to see for our long term is our secretariat, because they carry out the function daily for the council, and we are limited with human resource, and we would like to see an increase in staff members, because the work is becoming tedious. For example, we only have 2 field officers. We have our executive secretary as a secretary and 2 field officers. So getting more of those, we're able to reach out to our targeted personnel. I mean, you heard Karimu mention the preschools, the primary school, secondary school, the prison, the New Horizons. I mean, just look at it. If we increase, we're doing so many with so little. Just imagine what we can do with more.
I agree.
Because it's critically important that we do. So those are some of our long terms, and I hope I didn't forget anything. Okay, let's say we have a collective commitment to achieve impact through continuous quality improvement, full partner engagement, national unity in protecting public health. Yes, so those are some the plans that we vision for our future, and we're working tirelessly. Tedious, yes, but we're working tirelessly to ensure that we achieve these, to ensure that the work of the council is carried out.
Do you have any particular stakeholders, like for future plans to engage any stakeholders? This was one of the questions I have here for you guys.
Okay, so ways to engage
future stakeholders, yeah.
Okay, sure. as I would have mentioned earlier, we would have received the approval for our national drug policy, which took on a multi-sectorial approach in developing that policy. So through that policy, there are a number of activities that are outlined for us to implement, with specific stakeholders responsible for carrying out those activities. What we are hoping to do to further engage the general public, because everyone will have to be a part of this, on the books and almost rolling out, we're just on our final leg to start the implementation, is to develop a very comprehensive communication strategy or plan. And in this communication strategy or plan, we want to ensure that the messaging is standardized, it is clear, it is culturally relevant, so that it could reach not only those who are supporting the goals of prevention and the key stakeholders, but also the general public, to keep them informed. And I think through the right communication channels through this strategy, we will be able to bring more education and awareness to the issue. And from doing that, I hope that it would then support greater, implement greater support from the general community and partners and persons looking on, and ultimately give us a united front in the coordination and implementation of our prevention programs and activities. So it was partner agency and getting the messaging out as much as possible so that everyone is on the same page, people are involved moving forward. Currently, we do have social media pages, the Facebook and Instagram. And so we invite people to keep up to date with what we're doing. We give information, we share what we're doing, we give tidbits on.
Do we have like a week of activity for the National Drug Council? Like maybe if we don't, maybe that's something we can.
Well, actually, this Thursday, June 26th, Thursday, is the International Day Against Substance Abuse.
We did not know that. You need to repeat that for the public.
On June 26th, this Thursday, is the International Day Against Substance Abuse and Illicit Trafficking. And it is recognized globally, of course, and this is under the theme Breaking Chains, Prevention, Treatment, and Recovery for All.
You see, she knows these things at the top of her head. Which, you know, I appreciate you guys. It's almost time for us to wrap up the show. I don't know if each of you guys have a parting word that you want to leave with the public, but this is the end of our program. It was very interesting, informative, and I really enjoyed the subject matter. So I will start with you.
Okay, thank you, Monique. I am very happy now that some audience from the viewing public, wherever they are quite often now with some of the things that the council are doing. Because too often, some persons are not aware. And you yourself said you've been learning some things tonight.
Yes.
And we're happy. We want people to know of St. Kitts and Nevis and the wider region that the effort of the council is critical. Especially, I want to highlight that we have moved into the decriminalization of cannabis. And this means that we're going to see lots of misuse and abuse. And through education, through reaching out programs, we will be able to reach out to these people to educate them and put a step forward in our youth. And we mentioned our youth so that we could stop it
before it gets out of hand.
Escalated. So we continuously want to reach out to our private sector, our communities to work with us. We love you, we care for you, and we want you to partner with us to ensure that we're able to sustain our programs, our policies going forward.
Nice.
Thank you.
Anyone else?
Okay, I think I just say, yes, I just piggybacking on what ACP Rogers said. I just want to add that a part of what we need to do and want to do and have been doing is destigmatizing the conversations around substance use. And it is only when we destigmatize those conversations that we are able to do those very things that we want to do, to make sure that people have access, that make sure people reach out, make sure people use services, make sure people know about services.
I was about to say that, to make sure they know it's there.
So once we continue the work of destigmatizing the conversations, then we are on our way towards just making our home space in St. Kitts and Nevis that much more accessible to everybody. So I just wanted to leave that.
Awesome. Mrs. Byron-Caines?
Yes, I'll just wrap up real quickly. Just by inviting the general public to visit us on our social media platforms. I think there's a picture there that gives our contact information, our contact card. So if you can reach us at the National Council on Drug Abuse Prevention Secretariat, there we have it. Our phone number, although I'm not seeing the social media pages, but we can be found on Facebook and on Instagram. Keep in touch with us.
Oh, there it is.
We welcome your input. This Friday we will be on Central Street from 12 p.m. until 5 p.m. with the Citizen Security Secretariat at the Better Opportunity Fair. We will be able to share more information, so please be sure to look out for our flag, our banner. Come and meet with us, give us your input, let us know how we can support you better to ensure a safer and healthier St. Kitts and Nevis. Thank you.
Awesome. And as usual, I can't thank you guys enough for stopping by and for being such lovely hosts. Such lovely guests. I am your host, Dr. Lescott, and as this is the music festival season, I would like to leave you guys with a little tidbit from the National St. Kitts and Nevis Drug Council. I'm going to have my producer play this short video clip about drug prevention around the music festival season. I'm asking you guys to be safe and make sure you guys are aware of your surroundings.
Hey music festival goers, as we enjoy music in paradise, let's remember these safety tips. If you are permitted to smoke, know your limits, stay hydrated. Do not mix weed with alcohol or medication. Respect everyone's choices and stay in the designated high-rise area when smoking. If someone needs help, assist them. Know the medical tent location. Let's ensure a safe experience for all. Enjoy the music festival responsibly. This message was brought to you by the St. Kitts Nevis National Council on Drug Abuse Prevention.